I'm Sharon Tong and you're watching In Parliament. In the first half of this year, the number of unlicensed money lending cases has dropped 21% compared to the same period in 2011. These figures provided in Parliament by Second Minister for Home Affairs S.S. Warren also showed that the number of people arrested for such activities rose by 22% in the same periods. This continues the trend from 2 years ago. Still, Mr. Iswaran says the government has no intention of making it a crime to borrow from loan sharks. Instead, its focus is on preventive education, enforcement and community engagement.
Loan sharks are becoming more sophisticated and resorting to new methods to lure unsuspecting victims. This includes advertising their services by email and SMSs, as highlighted by engineer Dr. Lee. Licensed moneylenders are not permitted to advertise their services through such means. So we urge the public to be vigilant and report such instances to the police for investigation. Regardless of the mode of operation, police will act to disrupt and apprehend these loan shark syndicates.
Programs set in place to attract and build a pool of qualified early childhood professionals have reaped results. Acting Minister of Community Development, Youth and Sports Tan Chuan-Jin said the number of people working in the childcare sector increased by 25% last year. The rate of attrition has also fallen. Examples of the support given to this sector include providing scholarships to attract new teachers and encouraging existing ones to upgrade their professional qualifications. Non-profit anchor operators also receive a recurrent grant to help them recruit and retain teachers, and more is being done.
More than 4,000 training places with funding support will be made available over the next 3 years to bring in more early childhood professionals under the WSQ qualification programs. WDA subsidizes up to 90% of course fees and provide employers with an absentee payroll subsidy of up to 80% of the employee's salary. Moving forward, the Implementation Committee for Enhancing Preschool Education, chaired by myself and Minister Heng Swee Keat, will look into further strengthening the career and professional development of our early childhood professionals.
But there are challenges to attracting and retaining good preschool teachers. Mr. Chan says the ministry is looking at how the sector can be better organized so that operators can provide better career progression for their teachers.
One of the challenges that we are facing in this sector is that if the sector has many small operators, the small operators will always have problem providing the career opportunities for many of the teachers who may want to move up in their career progression. For example, some of them after a while may want to move on to become principals of centers, or some of them may want to take on some other curriculum development jobs.
Still on education, about half or 11,800 students at the Institute of Technical Education, or ITE, received help with course fees in the form of bursaries in the last academic year. Senior Parliamentary Secretary for Education, Hawazi Daipi, cited this figure in Parliament as he sought to assure the House that help was available to low-income students to grant them access to the full range of educational opportunities at ITE.
For local enrichment programs, ITE taps on EduSave grants to defray programs costs for all ITE students. For overseas enrichment programs, ITE students from low-income households can tap on the Opportunity Fund and the Could Take Part International Opportunity Program Fund to help cover the cost of their participation.
Acting Manpower Minister Tan Chuan-Jin says employers have generally been supportive of giving more to low-wage workers. He was giving an update on the National Wages Council's recommendation in May this year to give a $50 raise for workers who earn less than $1,000 a month. Mr. Tan said a survey of 80 companies who hire low-wage workers showed that 50 of them had decided on a wage increase between May and July. And out of the 50 companies, 3/4 granted a raise of $50 or more to these workers. The remaining 1/4, Mr. Tan said, either had a large number of low-wage workers or were limited by existing contracts.
Is there a suggested policy where government procurement is concerned to best source and fair price when awarding contracts, which will then have a trickle-down effect of raising wages to the contractor and the subcontractors.
Indeed, you're right. We should try to lead by example. As you're aware, we are working on the cleaning sector as well as the security sector. These are two sectors which do employ quite a number of low-wage Singaporeans, and we do look at how to work in a range of processes. I think announcements will be made shortly once it's ready, but accreditation, different requirements will be woven in. The key idea really is to make sure that wages can move up for this segment of our population.
As Singapore's labour market continues to tighten, Mr. Tan says companies need to tap the pool of older workers to meet their staffing needs. He said these older workers, especially the PMEs or professionals, managers and executives, are experienced, mature and arguably more stable workers who will stay on longer with their companies. The Education Ministry had recently announced more university spots for Singaporeans in the future. Several MPs, including Mary Liu, asked the government to consider more help for mature PMEs to stay competitive against young graduates.
Will the Minister consider offering or increasing available study grant to these PMEs who wish or who aspire to pursue a degree?
I think we should note that a person really does not necessarily need to be a university graduate to be successful. I think those who are, even in Singapore today, who are technically inclined, I think they can pursue many skills-based upgrading pathways and to go on to hold on to skilled and respectable jobs, be it in the PME job sector or other skilled jobs, such as associate professionals, technician, craftsmen, tradesmen, and so on, which continue to remain important in our economy in Singapore today.
National Development Minister Koh Boon Wan said home buyers are currently paying above the value assessed by professional valuers as it's a seller's market. Minister Koh was replying to a parliamentary query by MP for Tampines GRC Baey Yam King on the increasing cash over valuation figures.
The basis of valuation is the same for all HDB flats, whether they are for resale flats, transacted in the open market, flats affected by SERS, Selective En Bloc Redevelopment Scheme, or flats that are compulsorily acquired. Their values are assessed by a panel of professional valuers based on established valuation principles, taking into account factors such as location, size, story height, and the extent of renovations. Cash over valuations, or COVs, refer to the cash amounts which resale flat buyers pay above the market valuations to secure the purchase. HDB has always advised buyers to think carefully before committing to a price which is substantially above what the professional valuers have estimated. Resale prices are determined by willing buyers and sellers. The government cannot intervene to determine the transaction prices for buyers and sellers, but we help players make informed decisions through timely release of pricing data via the HDB website.
And Transport Minister Lui Tak Yew has explained how the downtown line construction work affected property in Watton Estate along Bukit Timah Road. Responding to non-constituency MP Gerald Giam, Mr. Lui said the incident was due to an unexpected and rapid drawdown of groundwater during excavation works for Downtown Line 2. When alerted to the incident, he said the Land Transport Authority installed more recharge wells to pump in water and stabilize ground settlement.
Since the early days of the incident, there have been no further reports of property damage. LTA has taken prompt action to make temporary repairs to the property damages for the residents, while investigations to ascertain the actual cause of the ground settlement continue. When tunnelling work for Downtown Line 2 is completed around the end of 2013, LTA will make good the damage to properties caused by the construction. Let me assure the House that LTA places paramount importance on safety and will take all appropriate precautions in the construction of our road and rail projects.
Minister for the Environment and Water Resources, Dr. Vivian Balakrishnan, said that the interest and safety of residents is paramount in the canal deepening exercise along Bukit Timah Road. He said this in response to MP Christopher D'Souza, who asked if the Public Utilities Board could expedite works near homes. The widening of the 3.2-kilometre diversion canal that diverts water from the Bukit Timah catchment into Sungai Ulu Pandan is expected to reduce the risk of flooding not only in the Bukit Timah area but also further downstream at the Balmoral, Newton Circus and Rocho area. The upgrading is slated to be completed in 2016.
The first one-third of the diversion canal, in fact, goes through some heavily populated residential areas, both landed estates, and in fact, there's a part of the canal which actually goes underground. So in fact, it becomes a tunnel. We've had to even move some residents out of their own homes during the construction phase in order to ensure safety. And we've of course made the appropriate compensation to these residents. We will ensure safety. We will also have the appropriate monitoring equipment in place to ensure that there's no damage to property, or even if there's a risk to that we detect it early and we address it promptly.
No losses were suffered by Singaporean Muslims who could not get a place to perform the annual Hajj in Mecca this year. Minister in charge of Muslim Affairs, Dr. Yaakob Ibrahim, said some Hajj operators, though, may have had to forfeit pay deposits for transport and accommodation. Dr. Yaakob said these operators were taking a business risk by catering to a larger market above the official quota of 680 places. Every year in the last 4 years, the Saudi government had granted Singapore 1,500 additional places for Hajj. But this year, because of massive construction work being carried out around Mecca, Dr. Yaakob said the Saudi government was unable to grant Singapore the extra places. Dr. Yaakob said the Prime Minister has appealed to the Saudi Crown Prince to allocate more places to Singapore.
The development projects in the Holy Land will take a few years to complete. We appreciate the efforts that the Saudi government is taking to ensure that more Muslims can make their pilgrimage safely and comfortably. In the meantime, we should be prepared and manage our expectation should we not be able to get additional Hajj quota in the next few years.
Singapore will welcome continued engagement from the United States to ensure Asia's prosperity and security. Defence Minister Dr. Ng Eng Hen said this in response to NMP Assistant Professor Eugene Tan, who asked how America's pivot on Asia strategy will impact Singapore and its bilateral relationship with China. The strategy refers to the US plan to boost economic and security presence in the Asia. For several decades, Singapore has allowed US military ships and planes to use local facilities in recognition of US positive influence in the region. And the Minister for Defence said US has adhered to the terms of the agreements. Dr. Ng also emphasised that the China-US relationship is one that will affect the peace and stability in the Asia-Pacific region.
Ultimately, Singapore is friend with both and hopes the US-China relationships flourish. We do not wish to see their relations deteriorate, and indeed, both sides, China and US, have openly affirmed that the Asia-Pacific region is big enough to accommodate both the US and China. Other nations need not choose better relations with one at the expense of the other. Instead, all stakeholders should work towards an inclusive regional security framework that builds common understanding and cooperation.
Parliament passed 2 bills today. One of them was an amendment to the Civil Law Bill, which governs the distribution of property that belongs to a person who dies without a will or next of kin. Under the bill, government can transfer such property to any person who has an equitable or moral claim to the estate. For example, someone who has taken care of or provided for the deceased. The amendment clarifies that the bill extends to both real and personal property within the deceased's estate. It also expands the bill's coverage to include CPF monies.
Such property is now excluded by law from the deceased's estate to protect them from creditors for the benefit of entitled next of kin. But when there is no entitled next of kin, It is only fair that such property can go to someone with an equitable or moral claim rather than the government.
The amendment does not affect property under Muslim law, which will continue to be dealt with under the Muslim Law Act. Now, rising in support of the Civil Law Bill was Associate Professor Fatima Latif, who said this amendment bill covers greater scope, but she also sought to clarify some concerns.
The amendment empowers the Minister, with no change to the existing provision, to release any bona vacantia properties to any person if the Minister is satisfied that person has established an equitable or moral claim on the property. Now, would the Minister require the claimant to obtain an order of court that the claimant has indeed established this before the Minister is satisfied with the claim?
A court order is not needed for this purpose. It is for the Minister to assess whether a person has a moral or equitable claim to property which has devolved to the government. That has always been the position, that continues to be the position. This bill simply amends to make clear what properties are covered.
The Voluntary Sterilisation Act, or VSA, has been passed in Parliament as well. First enacted in 1969, the Act was last reviewed in 1974. Health Minister Gan Kim Yong said with the changes to the healthcare landscape, it's timely to amend the Act now.
Singapore is working towards becoming a party to the United Nations Convention on the Rights of Persons with Disabilities, the UN Convention. We are therefore making amendments to the provisions in the VSA that may be viewed as potentially discriminatory against disabled persons.
The key change to align it with the Mental Capacity Act, which came into force on 1st March 2010. The Health Minister said the decision on whether a person is to undergo sexual sterilisation will be returned to those with mental or hereditary illnesses, but who still have the mental capacity to give their own consent. If the person lacks mental capacity, the changes give the court power to decide on behalf of the individual.
As an additional safeguard, the spouse or guardian will need to apply to the court for an order to proceed. Similar to the court's role under the MCA, the court may then make an order declaring that the treatment is necessary in the best interest of the person. This application will need to be supported by a doctor's report stating that the person lacks mental capacity to give his or her own consent to the procedure, and that the procedure is necessary in the person's best interests. Reference will be made to the provisions in the MCA in determining whether a person lacks mental capacity and whether the treatment for sexual sterilization is in the person's best interest.
The penalties in the amended Act are also stiffer. Persons who coerce or intimidate another person to undergo sexual sterilisation can be fined a maximum of $10,000, up from $5,000 before. Between 2003 and 2011, more than 27,900 people underwent voluntary sexual sterilisation. Now, members of Parliament have welcomed the amendments to the Voluntary Sterilisation Act, but the 8 MPs who rose to speak also raised some concerns, chief among them the protection of minors or young persons below 21 years old.
I must admit that I find it hard to comprehend why the bill requires a court order to authorize the sterilization of persons lacking in mental capacity, but does not require this for the sterilization of minors, who may also not be in a position, due to their relative youth, to give informed consent to sexual sterilization. Would the lack of such a requirement result in a decision that is not made in the best interest of the child? We're all aware that sterilization is an irreversible procedure that terminates a person's reproductive capacity. The termination of the reproductive function of a minor will more likely than not have both physical and physiological effects on the minor and will continue for an extended period of time.
There is a deep concern as to what extent minors, especially those who are much younger, are able to comprehend the concept of sexual sterilization. A number of countries either have a minimum age where persons are considered capable of consenting to sterilization or require a court order before a minor can be sterilized. This is not the case in our current or amended bill.
The definition of someone below the age of 21 effectively means any age from birth to below 21.
5, 6, 7, 11, 12, 13. So I find it very onerous on a young person, age, for instance, 15 years old, to partake in a life decision that is as invasive as sexual sterilization, a decision that's permanent, irreversible, to the extent that it will impair his or her ability to have children for the rest of his or her life.
In the case of an unmarried young person below the age of 21 years who does not lack mental capacity, there are 4 levels of safeguards. First, the young person must give his or her own consent, unlike in the case of a person lacking in mental capacity. Second, his or her parent or a guardian must consent to having the young person undergoing such a procedure. Thirdly, the amended Section 3.3 of the Act requires the doctor to give a full and reasonable explanation as to the meaning and consequences of such a treatment and obtain certification from such person that he clearly understands the meaning and consequences of the treatment. Fourthly, cases involving such young persons will be required to be referred to the Hospital Ethics Committee for review.
Questions were also asked about determining the best interests of a person who lacks mental capacity.
The amendment now makes it irrelevant to consider the interests of society generally, as this phrase will be deleted from the section. The decision now, whether a mentally incapable person should be sterilized, will be based on the consideration of the best interests of the person alone. What then amounts to the person's best interests? This is not defined in the bill, which instead directs us to Part 2 of the Mental Capacity Act for the relevant principles and definitions.
It is because the best interest of a person who lacks mental capacity is such a complex matter, we have decided that it should not be left solely in the hands of any one individual or caregiver, but should instead be decided by the court, taking into account the doctor's report and after considering all relevant medical, social, and ethical aspects of the case.
How many persons with disabilities have been sterilized in the last 10 years in Singapore under the VSA, and who had been the decision maker in such cases? Have we so far encountered any problems where the decision had to be revoked?
In the vast majority of these cases, 98% of them, most people undergo the procedure because they have achieved their desired family size and decided not to have any more children. For these cases, the person himself or herself had decided and given their own consent to undergo sterilization. During the period 2003 to 2011, there were only 9 cases where the patient underwent the procedure because of a history of mental illness or hereditary diseases. The records show that in 8 out of these 9 cases, the patients gave their own consent. There was only 1 case where consent was given by the person's parent.
Parliament has adjourned. Good night.